Hello. Today I will be talking once again about sexually transmitted diseases. This is our last video on STDs, and we'll continue with other topics in upcoming days. Hepatitis is one of the sexually transmitted infections that I have not covered. Hepatitis stands for inflammation of liver. It's a viral infection. There are a number of hepatitis viruses that we know of, and the ones that are sexually transmitted are hepatitis A, B, and C. Hepatitis A is associated with more of we call it GIT or gastrointestinal symptoms. People feel nausea, vomiting, and unwell. And most hepatitis symptoms are leading to jaundice, of having a yellow skin due to liver dysfunction. Hepatitis B is 50 to 100 times more likely to be transmitted than HIV during sex. And hepatitis C is more likely to be transmitted through blood, but it can also be transmitted sexually. Do the condoms protect? Yes, condoms do protect quite well against transmission of hepatitis. What sex is most commonly transmitting hepatitis? It will be anal sex, and vaginal and oral sex are not as common, but still possible to lead to transmission. Depending on what hepatitis it is, we have different types of treatments for it. Hepatitis B and C can lead to long-term liver dysfunction, liver cirrhosis, and quite terrible quality of life. So remember about this disease and use condoms to protect yourself from acquiring it during sex. Today I will also answer a few questions and uncover some myths of STDs. So first question, can condoms protect against STDs? Well, condoms do protect against majority of STDs. They work very well if you use them with each time of sexual encounter from the start of the intercourse. Condoms that we use for STDs protect against HIV. They don't protect so well against HPV or human papillomavirus, which is transmitted through skin to skin. Condoms will not protect very well at times against herpes infection, because if they don't cover fully the skin that is infected with herpes, the infection can be transmitted. Obviously, for oral sex, condoms will not work unless you use it at all times with oral sex as well. Or use female condoms. So use condoms every time you have sex to protect yourself against STDs, but remember that it will not help with human papillomavirus that is transmitted through skin to skin. Can one have STD and not know about it? Yes, majority of women and some men can have sexually transmitted infection with no symptoms, and that would include chlamydia infection, HIV, at times even gonorrhea has no symptoms, and definitely a few others such as human papillomavirus or herpes or hepatitis or syphilis even. So it's quite possible to have no symptoms but to have sexually transmitted disease. Therefore, if you suspect that you might have it, it's important to have regular checkups once a year for people with no symptoms who suspect that they might have gotten it is quite important to do. Next question, will I become infertile after having a sexually transmitted infection? There are certain sexually transmitted infections, such as chlamydia and gonorrhea, that can cause infertility by causing damage to fallopian tubes. Not everyone who has chlamydia or had chlamydia in the past or gonorrhea would have infertility or end up with infertility. If this infection is treated timelessly, you may have no problems in the future and will be able to fall pregnant easily. However, there is a small chance of having infertility due to chlamydia or gonorrhea. Next question. Does having human papillomavirus or HPV mean that I have cervical cancer? No, it does not mean you have cervical cancer. It does not mean you will develop cervical cancer. However, HPV or human papilloma virus does predispose people to developing abnormal precancerous and going further along cancerous cells on the cervix. But only a small number of women who have human papilloma virus will end up with cancer of the cervix. Because we have such a wide screening program for HPV and a vaccination program that was introduced quite a while ago, the risk of developing cancer has decreased quite a lot all over the world. It's important to have regular checkups and pap smears or HPV test. And if your HPV test is negative, that means that your chances of developing cervical cancer in the next 5 to 10 years is pretty much zero. If the HPV test is positive, you will have further testing of the cells abnormalities on the cervix to look for precancerous cells. If we find them, we can remove them well before they develop into cancer. It takes a long time to develop cancerous cells, about 5 to 10 years, if precancerous cells are left untreated. So having HPV does not mean you have cancer or you will develop cancer. It means that you have to have regular checkups to prevent development of cancer. Next question. I only had one sexual partner in my life, and does that mean that I don't have an STD because I've only had one partner? No, not at all, because you don't know how many partners your sexual partner might have had in the past. If he's also had only one partner, or you were both tested for sexually transmitted infections before you stopped using protection such as condom when you're having sex, then it's not likely that you have STD. However, if you're having unprotected sex and your partner has never been tested, the best thing to do is to have a checkup to make sure you don't have any problems. Next question. Can I transmit or pass on a sexually transmitted infection to my partner without knowing it? Yes, it's quite possible, because there are lots of STDs that one can have with having no symptoms, and if you're having unprotected sex, you can transmit them. Does having itchy and burny vagina mean that I have STD? Not at all. The most common cause of itchiness and discomfort and burning in vaginal area, as well as cause of green discharge or cottage cheese-like looking discharge, are yeast infections or candida infections. And it's not a sexually transmitted infection. It's something that's related to lifestyle issues and certain dietary choices that people make. So that's not an STD. It is possible to have burning and itching and have an STD, but I see it less commonly than candida or yeast infection. And we'll talk about candida in our future videos. And the last question, does HPV vaccine protect against all human papilloma viruses or HPV? HPV vaccines protect against certain HPV viruses, but not all of them. There is over 100 HPV viruses, and a number of them are associated with cancers in our body, and in particular with cervical cancer. HPV vaccine protects us against the most commonly HPV viruses that causes cervical cancer. So the HPV viruses that causes 80% of cervical cancer are included in this vaccine. But it's definitely not all of them. Hence, even women who had HPV vaccine still need to have HPV testing and pap smears to make sure we can detect any abnormal or precancerous cells quite early on. But the vaccine will prevent them for most of the cases. And that's all on STDs. Thank you. If you have any questions, please do send them through and we'll answer them in the next day or so. Thank you. Bye.